Sometimes I've met a lot of folks where they were dizzy and they went to their doctor and their doctor said, well, you're getting older. I will tell you that persistent dizziness especially is really not a normal aging process per se. So if you have dizziness, that's something that should be addressed. We know from research, and this was a study actually published in 2024, that adults who are 65 or older are twice as likely to have recurrent falls. So it's actually something that really should be addressed. Now, we talked about how there's all these different types of dizziness, and I will say I've had patients or people come to see me for dizziness, and they were referred to me from a doctor because they were dizzy, and they'll come in and they'll say, yeah, I'm not dizzy. I'm not dizzy. I'm just off balance. So again, when someone says or is referred to me with dizziness, there's so many different descriptors, and people may not even recognize it as a dizzy problem. So there's actually 4 main types that they're sort of categorizing. The first one is the disequilibrium. That's when you feel off balance, you feel unsteady, you feel wobbly, you might not feel like you have control of your balance. That person could say that they feel dizzy. Another one is the lightheadedness, where you feel kind of woozy, you're not quite sure what's going on in your environment. That's another description that people will say. Well, I feel lightheaded. I'm not dizzy, but I'm lightheaded. The classic one that almost everybody knows about is vertigo, right? So vertigo is a sense of spinning, it's a sense of motion of the room or your body. So some people will come in and say, well, I feel like I'm spinning, or I feel like the world is spinning around me. You could also have other types of motion like rocking movements, up and down movements as well. Those are more classified as vertigo per se. And then the last one on there is more of that pre-syncope. What is that? That's person right before they're about to faint. So, you're kind of losing consciousness. So those are different kinds of dizziness. And actually, the type of dizziness you have can clue us into what's going on with you. So we, oftentimes, I'll spend a lot of time asking people, well, what makes you feel dizzy? What makes you feel worse? What makes you feel better? Are you dizzy all the time? Is there something in particular that make you like, oh, I'm going to get dizzy with that? So those kinds of things are the types of questions when someone comes to see someone like me, I ask. I say it's sort of similar to pain. Pain is a very subjective complaint, and there might be things that make it worse and things that make it better. So dizziness kind of is the same thing. There are things that make it worse, there might be things that make it better, or it might be the same the whole time, and that could be a whole other problem. So I talked about, that there are different causes and reasons for dizziness. And I have a long list here, I don't know if you can see that. And did you all get a handout? I did bring handouts. I'm not sure where they were. I thought I gave her some handouts to pass out. But anyways, so there's a lot of different reasons for dizziness. And it could be something really non-threatening, and then it could be life-threatening. So again, it could be something that I didn't sleep well the night before, and I'm walking around and I'm feeling a little foggy. I'm feeling like foggy, not all there, maybe a little lightheaded, extreme fatigue. Those kinds of things can actually make you dizzy. Another one, of course, which is a little bit more major, is the cardiovascular system could have a problem with it. So a really common one for this would be someone with like a heart arrhythmia, which would be something like atrial fibrillation. Anybody know what that is? So basically, that's when your heart is kind of beating maybe really rapidly and kind of irregularly. And so those kinds of things can make you actually feel a little bit dizzy or lightheaded, that kind of thing. Another one, of course, is neurological. So neurological problems, any kind of brain issue. So people that have had strokes can be dizzy, and it really depends on where you had the stroke. You know, you can actually have a stroke that affects your balance system. Everybody typically thinks about stroke as, well, I'm weak on one side, or I can't speak, and those are the classic signs of a stroke. Well, other signs of a stroke can actually be very sudden hearing loss, difficulty with your balance, and feeling dizzy. So those also could be contributing to the dizzy problem. I put on there migraine headaches in that same category because that's kind of related to the brain as well. People that have a history of migraines are more likely at some point, and not always, but they can develop something called vestibular migraine. So it's a type of migraine headache where you don't get the headache part of it, but you get dizzy. So you can actually have vertigo or dizziness from a migraine, and it could be actually a migraine. A lot of women go through this sometimes with the change in life. So when your hormone levels kind of drop and change, sometimes this will happen. Sometimes people are, they started off when they were young with migraines and there was a certain way, and then all of a sudden it changes. And that can also be a migraine, believe it or not. Okay, so some other ones are low blood sugar. Obviously low blood sugar, that's a classic. Sometimes people will feel lightheaded when their sugar drops really low. If you didn't eat for a while, if you're suffering from diabetes and you take insulin, sometimes when you're taking the insulin, it can cause a drop in your sugar, and so that can also create some symptoms. Another one are medication side effects. And I'm sure you know every medication you've ever gotten on there will say, one of the side effects is dizziness. That's not an uncommon thing. What I like to say, if you're having dizziness every time you first take the medicine, it could be the medicine. So, again, that's why I ask people, tell me about your dizziness. When do you get dizzy? Are you noticing any patterns with it? Especially if it's a new medication, that could create some feelings of being lightheaded. Especially anxiety medication sometimes, if you change your dosage or you stop it suddenly, it could actually make people feel very dizzy when they're titrating off of a medication as well. All right, and then moving on, dehydration, which is something that I think we experienced last week here. So very common when you don't drink enough water or you don't have enough fluid, that can make you have low blood pressure. So you have to remember that blood is mostly made out of water. So if you are restricting and some people have to restrict their fluids because they have a medical condition that makes them, okay? But if you are, not drinking enough fluids during the day, you might notice, feeling really fatigued, first of all, feeling lightheaded, especially when you stand up, those kinds of things. Low blood pressure, also, you could have something called orthostatic hypotension. I don't know if any of you have ever heard of that one. But that's when you actually can have a drop in your blood pressure when you change positions. So your blood pressure might be one reading when you lie down, and then when you sit, it goes down a little bit, and when you stand, it goes down even further. And so these are some of the things that we'll assess. I'll make sure that someone's not having, where their blood pressure is dropping every time they change positions. Did you drink enough water? Those kinds of things. Okay. Another thing on my list here is anxiety and stress. So this is very, very interesting because we know more now than we did, say, 30 years ago. One thing that we know, and I want to share this, that when I first started working at the Eye and Ear Institute, they were actually doing a study, a couple of the researchers there were studying the connection between the vestibular system and the parts of the brain that control, I guess, anxiety and emotion, those parts are called the limbic system. So the limbic system, there's something called hippocampus and the amygdala. They actually have neural pathways, connection between the parts of the brain that control the balance pathways. So the truth is, you can have anxiety and your main symptom could be dizziness. So there are people who, they might feel lightheaded or dizzy whenever they're feeling anxious. So when their anxiety is ratcheting up, that could actually be one of the symptoms. I always found that to be fascinating. And the other thing is that if you've had a history of anxiety, you are actually more likely to have a vestibular problem than someone who doesn't. And vice versa. If you have a vestibular problem, you are more likely to have anxiety. They almost go hand in hand. Usually when someone has an inner ear problem, anxiety is like another component of it. And for some people it's really bad, and other people it's more manageable, but it's usually there, almost all the time. Okay, and then another one on my list is vision changes or an injury to your vision. So this is usually, I would see this after someone has, say, a traumatic brain injury, where they have a concussion, for example. So we know that after concussion, I think 30% of those folks will then have some vision changes. And what happens sometimes is that basically our eyes are two little sockets and they connect to our brain, right? So when we're looking at a target, usually both eyes are looking at the same target. But sometimes people can have a problem where one eye is maybe out just a little bit, or it may not even be noticeable. I'm sure you've seen the person that has, we call them atropia or strabismus, where their eye is all the way out to the side. I'm sure you've all known somebody in your life like that. Those folks tend to maybe have been born with it. Maybe when they were younger, they didn't have surgery or they didn't have therapy for it, so they learn to adjust, basically. So what can happen is if you have a brain injury, you can actually have this problem recur if you had it when you were younger or you adapted to it. So vision changes and an injury can actually make a person dizzy. And last but not least, on my list here, are inner ear disorders. So I've been saying the term vestibular. That's the fancy word that we use. And it's basically entailing a lot of different structures between our inner ear, our brain, and then all the connections that makes to the rest of our body. In order to keep our balance when we're walking and moving, those types of things. Okay. So again, the type of symptoms that you're having is part of how we distinguish what's going on here. And some of them can be bad, and some of them could be, simple and easy to fix. Let's go on to this. So I don't know if I'm speaking in too much detail, and if there's something you need me to back up on, by all means, let me know. But usually when someone comes in and sees me and they have a balance problem and it's related to their inner ear or their senses, I like to explain what's going on, because I feel like if you know what's going on, it reduces your anxiety about it, right? So we have our brain over here, which is a nice little picture of that. This is an eyeball, believe it or not, so that's a nice picture of our eyeball. This is the inner ear, or the labyrinth, we call it. And then we have our feet. So we have different, what we call sensory inputs. And what does that mean? It means that our body is taking in information about our environment from different senses. These main senses, our eyes, our inner ears, and like basically our muscles and joints and bones and skin can tell our brain about how we're moving in the world. If we're standing, if we're walking on a different type of surface, our feet will be able to tell that. Our eyes can see movement, so it senses movement as we're moving. And then our inner ear is always working, basically. It's always sending signals to our brain, even when we're not moving. It's kind of this sense of, it's sort of our main balance organ, okay? All of those things send information to our brain, and our brain processes it like a nice little computer, and then it actually responds by making muscles move. So basically, once that information goes to our brain, it sends information down through our neck into our spinal cord, which is, you know, the tracts of nerves that are in our spinal column. And then that gets sent out to our muscles. And then our muscles, again, this is the sensory. So the sensory is like the input, and the motor is the output. So it's like input, computer, output. But this all happens in split seconds, right? It's so fast. So if you are like, there's some people that have a balance problem because they have a problem with the sensory parts, okay? Like their inner ear isn't working, or their eyes are messed up, or they have a neuropathy in their feet, and that can affect your balance, okay? And then there's some people that have a balance problem because of their motor output. A good example of that is someone that has a spinal cord problem. So their spinal cord, maybe there's been some injury here, and so when the connections come down the spinal cord, that maybe is too slow, or you know, so it's not your person's not able to react as fast or not as strongly as they should. So sometimes, you know, it's a motor output, and then sometimes it's both, right? So you can have problems with both the sensory and the motor output. A good example of a motor output problem besides a spinal cord injury would be someone with Parkinson's disease. So people with Parkinson's disease, their basal ganglia, they have issues with the dopamine, being able to use dopamine when they're moving. The basal ganglia is this part of the brain that helps to control muscle responses, okay? So again, you know, our muscles are basically activated by our brain, you know, to maintain our balance, whether we're thinking about it or not. It's an automatic thing, really. And we use our muscles to react to unexpected movements. So that's what a perturbation is. So if somebody, like, for example, you're standing on the train, you're in the airport, you're on the train, you're going to your gate, and you're on that, you know how hard that is, right? Like, and if that stops really suddenly, you know, you'll start to move. So your muscles will actually react to those kind of perturbations, and a change in the environment. So when things are working good, everything's working together, you know, and then we can react very quickly. Okay, now let's talk about the vestibular system. I'm not sure you can see that picture really well, but there's an ear. Here's our outer ear, our ear canal, our eardrum. This space here is where it's called the middle ear. So this is the outer ear, which is up to the eardrum. The middle ear space, which that's connected to the eustachian tube. And why is that important? When your grandkids get an ear infection, what's happening oftentimes is there's an infection backing up from the sinuses into that middle ear space. And so you'll see like the eardrum will get real puffy, and that can affect, but sometimes that even can affect your balance too. And then this weird looking apparatus, and there's a clear picture over here, that's called the inner ear. So there's three parts to our ear: outer, middle, inner. People will come in and say to me, well, my ear is fine because my doctor looked in my ear and said everything was fine. Well, your doctor can only see up to the ear canal, or, you know, the ear canal and the eardrum. They can't see anything past that. So if you have an inner ear problem, they're not going to be able to see it on their scope. They might be able to tell if you have an infection behind here, but that's it. Sometimes people can feel an ear fullness, ringing in the ears, you know, and those can be symptoms of what a person is having. So the inner ear, or the labyrinth, is kind of like the nerve center. That's a good way to put it. Sort of like the balance nerve center. For balance and hearing. So this portion that looks kind of like a snail, that's for hearing. And this portion that looks, and it's hard to tell on paper, but basically there's 3 canals, and they're aligned at 90 degrees to each other. Those are called the semicircular canals. You're really getting a lesson here today, so there will be no test on this, I promise. But I like to explain it, and the reason I feel like if you have a little bit of knowledge, if you have an inner ear problem, it makes you understand why we're doing what we're doing. This is why we're doing it. Okay. So let's go. Let me move on here. So
We're going to talk about
yes.
how do they know when it's the inner ear or if they can't
the outer
see?
ear? Yeah. So when they look in your ear, if there's an infection in your outer ear, that's called swimmer's ear.
Okay.
They will see it. They'll be able to see it. That's something they'll be able to see. And they also might, sometimes they will see an infection. The eardrum will look like red. Okay, and that's how they know. If everything is looking fine that way, but you're having ear fullness, like pain in your ear fullness, it could be an inner ear problem. And there's testing that we do to figure that out. So I'm getting to that part.
Okay, I'm sorry.
But no, it's fine. Those are great questions you're thinking. So yeah, because that's, how do you know then, right? This is why I love what I do, because I love trying to figure it out. Like when people are dizzy, I love trying to figure that out. Why are you dizzy? There's, as you can see, that's a lot of reasons, right? So it's really important to go to someone who knows what they're doing, because then then they can figure it out. Okay, so looking here, I'm looking a little closer, so I'm getting deep into this. So bear with me on this. I know it's not easy. So in general, there are this blue line that kind of goes around. It's sort of out. That's inside everything, and that's called endolymph fluid. There's fluid in our inner ear, always. Okay. And that's important for later, because we're going to talk about why that would be a problem. So those fluids are called endolymph. This is one of the canals. So this is kind of a weird picture of one of these, okay? So as you can see, it goes around, and then there's this bigger part right there, all right? So why is that important? Because there's fluid in here, and then there's something called a cupula. It's like a little sail. And it sticks up there, and as you turn your head one way and the other, that fluid is going to, just like a pneumatic system, right, or a hydraulic system, it's going to move, it's going to slosh around in it, right? Cool? That's how it works. So it sloshes around, and as it does, it comes up and it pushes that cupula one way, or it pushes it the other way. And that sends information down a nerve to our brains, right? So, and we have 3 of these. So, because they're oriented in different directions of planes of how our head moves. So there's one that's responsible for like up and down movements. There's one responsible for side-to-side movements. And anterior canal is also responsible for like more looking down types of movements. So that's one part of the balance system. And then the other part are the rocks or the crystals. And I'm sure all of you have heard, you have rocks in your head, right? I used to work with this one physician that loved to tell people when they came in with a problem, well, you got rocks in your head, and the rocks are a problem. So that's another thing. Is we have these 2 little sacs. One's called, again, you don't need to remember this, but one's called the utricle, and one's called the saccule, and that's where the little crystals live. They live there. We make them. They're made out of calcium carbonate. They look, and that's an electron microscope, by the way.
You can't see them, can you?
You can't see them, no. You would need an electron microscope, and again, they typically do, like this is a lot of research done, after people have died, right? Okay. Or on animals. So, because everything has them, even fish have good ammonia. So these are called crystal, there's a lot of names for them. Crystals, rocks, podaconia, calcium carbonate crystals. When we're young, they're nice and small and round. And as we get older, they get bigger, they get more irregular. Sometimes they clump together even, right? So as we move, if I jump up and down, what's happening is my little crystals are going up and down too. So they're going up and down, and they kind of hit the walls and the sacs, and that also sends signals to our brain about how we're moving, all right? So again, this is more, I always say that the canals are more rotational types of movements, and the crystals are more up and down types of movements, or back and forth, linear types of movements. How cool is that, right? Our bodies are, made for some really miraculous things, I think. So it's really, really cool. So why is that important? It's important because sometimes there's a problem here, right? And that might be how we figure things out. So, I get so excited, as you can tell, talking about this. I love this stuff. So anyways, going back to the inner ear, let's talk about the three main causes of vertigo. So remember we talked about the different types of dizziness? Well, these problems can cause vertigo, lightheadedness, balance problems, they can cause all of it. But the most common one is something called BPPV, or benign, it's a mouthful, benign paroxysmal positional vertigo. That's the crystal problem, okay? That's probably the most common inner ear problem that a person can have. That doesn't mean it's always the cause for vertigo. Typically people will have problems with vertigo or dizziness when they change positions. So if someone comes in and says to me, I got up out of bed and the room started spinning, okay, my ears are peaked because I'm thinking it could be that. That doesn't mean it is, but it could be. Or I went to lay down in bed and all of a sudden the room started spinning. So if you have those kinds of symptoms, more than likely it is that. It could be something else, but it could be this, all right? So that's a really common problem, and we can fix that, believe it or not. So what it is that your crystals are not where they should be. Instead of them being in those little sacs that we talked about, some of them have migrated into one of those canals, and they don't belong there. So if that's the problem, it's going to create vertigo when that canal is stimulated by the particular movement. Okay? All right, does that make sense? Woo-hoo. All right, next one that's really cool. Yes?
Can you have a situation where the crystals are going out of, or becoming displaced and then correcting itself and then becoming
Coming out
displaced
again.
again?
Yes.
Back and forth, so.
Yes.
So intermittent vertigo.
You can have that problem. If you have one bout of BPPV, you're more likely to have another bout. So, and sometimes it does fix itself on its own. I would say if it does fix itself on its own, it's usually within a week to 10 days. If it's past that, no, it's not going to fix itself on its own. You need some help. You're more likely to have it happen again too if you haven't had any intervention, because one of the things that we think happens sometimes is they maybe are not out of the canal, but they've settled somewhere and are kind of like hanging out there. But when they become just like, they might stick a little bit, but then when they move again from, and the other thing that people do is then they stop bending over because they think, I'm gonna get dizzy, so I'm not gonna bend over. So they don't get dizzy, so they think their problem is fixed, but it's not. The crystals are still there. You're just not stimulating that canal enough to make it go into vertigo. So I always say, if you're having bouts of BPPV, like that you think, you should go see somebody, because it's not going to fix on its own. It's not. At this point, you need some help. Meniere's disease is another one. I am gonna come back to the BPPV thing for treatment. Meniere's disease, very common. Anybody in here know somebody that has Meniere's? So Meniere's disease, what is that? Another name for it is that fancy name, endolymphatic hydrops. In the name, it tells you what's wrong. Basically, that fluid that we talked about in your inner ear is 2 or 3 times the size. So what will happen is your labyrinth will look fat, basically because there's too much fluid in there. And that when there is, it distorts like how everything works. And it's not uncommon for people to have both Meniere's disease and maybe a bowel disease. So Meniere's disease, they don't really know what causes it. There is some thought that it might be an autoimmune problem. So like people that have, which when you think about it, makes a lot of sense to me, because if you're retaining, like a lot of times, when we have autoimmune issues, we might retain fluids or lymph, and that's what that is, lymph. It's lymph in our inner ear. So I've had people where they will go on a special diet, like they find that there's triggers for their Meniere's. Like there might be food triggers, environmental triggers that actually trigger Meniere's disease. One of the first symptoms for Meniere's is hearing loss. So you could have ringing in your ears is sometimes also a symptom. It's also a symptom of hearing loss too, so that tinnitus or ringing in the ears. So when people first start to have bouts of this, they could have a bout where they can't hear very well, and maybe that's the only symptom. They can also have vertigo with this. They could also be really off balance. You could have all of those scenarios with Meniere's disease. And then it goes away. And they might have a bout of it and it completely goes away. So again, that's another reason why if you're having bouts of vertigo, you should really see somebody, because a lot of people would come to me and say, my doctor sent me here because my crystals are out of place, and I evaluate them, and their crystals are not out of place. It's not that. It could be something else. Meniere's is one of those things, okay? And how that's treated, typically, sometimes it's treated with certain medications to help with the vertigo spells, as well as medications to help with the swelling. So they might give a person a diuretic actually for something like this, and they might give them like meclizine or over the counter. Can't think of it right now, but those kind of medications sometimes are helpful. And then PT might be helpful too, because what can happen over time is that you tend to have, and some people might have a bout or two and never get it again, but there's other people that will have recurrent bouts. And what happens is you're starting to lose function every time you have a bout. In other words, your ear is not sending the signals like it's supposed to every time you have a bout. And so some people get to the point where they lose all hearing in that ear, and they don't have any balance function in that ear. You can learn to live with one. So you can actually survive. You can learn and compensate, I should say, and live with one side. Okay, time and looking at the time. Okay, so another one is an ear infection. So this one is like a virus comes and attacks your nerve or the labyrinth itself. So this is also a very common reason why people have vertigo. This tends to be, so depending on which part of the inner ear, you can also have hearing loss if it's affecting the labyrinth, because the labyrinth has your hearing in balance portion. Or you could just have the vertigo where it's affecting the nerve. So I've had people where they had a bout of the flu or some kind of virus, and then all of a sudden they started having vertigo. And that's because you've got this virus attacking basically your inner ear, the nerve, or some part of it. And then if you lose function, basically that side's not going to work. Now you've got this ear that's working and this ear that's not working. So what happens is, what vertigo is it's basically your brain is confused and thinking that you're turning. Because this one's still sending signals, and this one isn't doing anything. So what's that signal? Well, that's a signal for turning to the left. So a lot of times that's why people get a vertigo sensation, because you've got one working and one not working. And so that can create that sensation. Other kinds of causes, diabetes. I wanted to mention this because I've seen a lot of folks who, if you have uncontrolled diabetes, because there's damage to the blood supply of smaller organs, like the nerves that go to your feet. So sometimes people will have what I call like a multi-sensory problem, where, they've sort of lost a little bit of function in all of those. And so that can make a person feel really off balance. Again, that would be another reason to see a PT and do balance therapy. These are some other ones: vestibular migraine, which I talked about, concussions, anxiety, I already talked about those. And then this one is a chronic problem. It's called persistent postural perceptual dizziness, or PPPD. That one's a really tough one. That one is usually someone that's they may not have it every day, but they have a persistent sense that they're off balance. And they might have a good day where they feel good, and then they might have a bad day where they feel terrible. Usually it's someone that had maybe an initial vestibular or inner ear problem, and it just never really went away. So this is, yeah.
Can I ask you a question about those crystals?
Yeah.
This wasn't from personal experience, but some of my friends that talking to them say that when they have that inner ear thing, the crystal problem,
Yeah.
that they're told by their doctors to hang their head over the bed,
Yeah.
lay on the bed and and your crystals will eventually go back to the way they were. Is that a solution for that?
Well, that's a great question, because there are these things called repositioning maneuvers that PTs and other people who treat people who have the crystal problem. Someone, I think like 10 years ago, invented this thing where if you did a somersault, because here's the thing, you have to know what canal you're treating. Like, you can have it in the anterior canal, the posterior canal, or the horizontal canal, and there's different treatments for that. You would do a different maneuver, but that one where you're just hanging your head over and back is probably one way to try to do it on your own. I will say I've seen so many people that try to do it on their own, and then what happens is they wind up with crystals in multiple canals. So I'm very for some people maybe it works, yeah, I'm sure it does. But I have seen so many people where it created more of a problem that I'm really leery about, and then some people can't physically do that, like hang their head over and then back up. It might help. Like sometimes, like I said, it could go back in place just on its own for movement. So you could get lucky and put it back in place yourself. So how do we diagnose these things? And I am going to talk more about that. So basically, we look at your head and eye movements because there's actually something called a reflex that when your crystals are out of place, your eyes will actually bounce around in a particular direction. And the position of your head, the direction of the eye movement, how long it lasts, all of that tells me where it is. So I can actually figure out which canal it's in based on looking and examining positions, your head, and your eye movements, okay? We also look at a person's balance, and then this is called vestibular lab function testing. That's what you would have to go to a special lab for that, which I don't really send people there unless I feel like we need more answers, and that's a whole other topic, let me tell you. So, depending on the diagnosis is going to depend on what you do. One size does not fit all. And the reason I want to say that is a lot of people come in with dizziness and they're doing those repositioning maneuvers that we talked about for a problem that is not about their crystals. So again, if you've got loss of function of one nerve, or you've got, an autoimmune disease in your ear, doing a repositioning maneuver is not going to fix the problem. And I have seen multiple people where they saw someone frequently and they weren't getting any better. So the key is, if you're not getting any better, then you might need to reevaluate what you're doing or what's going on. Now, so other things that we'll do is something called gaze stability exercises. So those are exercises where basically you focus your gaze and you move your head, because that will help teach the brain how your nerves are functioning now. So if you've lost function in one ear, from an infection, you still have another ear working. So doing different kinds of head and eye coordination types of exercises actually helps your brain relearn how to interpret those responses from your ear. So we may not be able to change how your ear is actually functioning, but we can change how your brain perceives it. And so that's what the exercises are for. So I'm going to flip through these kind of quickly. So these are other treatment things that we'll do. So here we're manipulating the senses that you use for balance. So I have someone standing on a piece of foam. Maybe we start off with their feet apart, and they're in a corner so they're safe, and they close their eyes. So here we can't use our vision for balance, and we're making it hard for you to use your feet for balance. So your inner ear is sending all, your brain is relying on your inner ear mostly. So these are, we call these sensory organizations. So we're manipulating the sensory conditions in which you do different balance tasks. So that's one of the strategies for therapy. And then this is really a much harder progression, right? So you might have people turning, again, turning your body, turning your head, makes your vestibulars, your inner ears send different signals. So we might incorporate that. We might incorporate, reacting, catching a ball, focusing. There's all kinds of things that we might do. So in general, as we age, like our inner ear might not be as strong as it used to be. Just like we need glasses when we get older, we might need hearing aids because we can't hear. It's the same thing for the balance portion. So the balance portion also gets older. We talked about how those crystals, they change in size. The hair cells in there also, there's less of them. So there's a lot of folks that come in and they maybe aren't really dizzy, like they don't feel like they're moving, but they feel off balance, or they've had some falls. So, basically that then contributes to people being less active, right? So if you are if you feel like you're gonna fall, you're gonna be less active. And there's a lot of people that are like, well, they don't want to walk with their walker, or they don't want to walk with their cane because they don't want to be dependent on it. But the truth is, what's happening is you're going to walk less. You're going to walk less because, it's going to take more energy and effort for you to walk without your device if you need it. Not everybody needs a device, even with this problem. But if you need a device and you're not using it, you probably unconsciously just move less. And we know that motion is really the treatment for this. So exercise, movement, and motion actually helps you get better. So I would much rather, if you need a walker or cane, use it. Because you're not going to be dependent on it. You're actually more likely to get off of it if you move more and walk more. And if that's what makes you safe, and you'll do it more. So the other thing too is that older adults are more likely to have what we call multiple canal BPPVs. So when your crystals are out of place out of one canal, it could be out of place in more than one canal. And I've had people where, like, one canal is a dream. Someone comes in, it's out of place in the posterior canal. That's not too hard to fix. But if you've had it on both sides, in the horizontal canal, the posterior canal, the horizontal canal, I've had people with that, and it's really hard to treat. Those folks will take a long, long time to get better. And like I said before, if you've ever had an episode of BPPV, you are more likely to have another one. There's some people that go their whole lives and they never have one. There's some people that have one, and then there's other people that they come in every year with it. The interesting part is they don't really know why, but it does happen. So we know from research that balance does improve with physical therapy, with exercise. If you can see that. Older people who have chronic inner ear problems actually can still benefit from intervention, from therapy. And there actually are a lot of vestibular people, PTs like myself, who specialize with this. We're lucky in the Pittsburgh area, and that's mostly because of Dr. Furman. Dr. Furman is a physician at the Eye and Ear Institute, and he started working there, I want to say, in the 80s. And when he started working, he was like, I need some PTs too that I can send them to. And so Pitt actually is probably primarily responsible for training, not just people in the Pittsburgh area, but in the nation. There's a lot of people that come to Pitt for training with vestibular issues. So we're kind of lucky here. There's a lot of people that live in a more rural area, and there's like, no real specialists that help them. Vestibular disorders are not preventable, unfortunately. It's not like, people always ask me, what can I do so I can never get another bout of this again? And the truth is, they're really not preventable, depending on the problem, of course. But I always say that if you're more active, I think it's better for you in the long run, even if you do get it again, it will help you. It will help you because your balance will be better. There is some studies that have looked at vitamin D levels. What they found, and this is really, I can tell you this as a practicing PT, that people with BPD, the seasons for that are spring and fall. And why that is, we haven't known I can tell you, after doing this for so many years, that spring and fall comes around and everybody comes in with BPD. Their crystals are out of place. Why is that? We are not sure, but there's some thought that there is a change or a drop in your vitamin D levels, sometimes seasonally. So, you've gone all winter, and all of a sudden, like your vitamin, you're not getting sunlight, because that's how we get vitamin D. So all of a sudden, your vitamin D levels drop. And vitamin D and calcium are really related. Again, remember those crystals are made out of calcium carbonate. So there may be a connection with vitamin D levels. There are some preliminary studies about that. So you want to make sure you're getting enough vitamin D. So you want to talk to your doctors about that. Typically, Pittsburgh, we are bad about getting vitamin D because we don't get a lot of sunshine here. The other thing is that make sure as you're aging, you're getting enough protein, because that really helps to keep our muscles strong and make more muscle. And you can build muscle even in your 90s. So, but if your protein intake or you're not eating, and a good example of this is I've had someone not that long ago who had a gastric bypass surgery. And people with gastric bypass surgery tend to be very malnourished afterwards. So you have to be really careful, or people after cancer where they drop a lot of weight. And what happens is your body will lose muscle mass. So when you drop weight, you think, oh, I'm getting thinner. The truth is you might be losing more muscle mass than actual fat or adipose tissue. So you have to be really careful about taking protein and exercising, keeping those muscles strong. Because as we age, we lose muscle mass too. The other thing we talked about is managing your blood pressure, right? Your A1C levels, that's your blood sugar, and making sure that your doctor's looking at that. So if you have diabetes, trying to keep it under control. Sleep is always important. That's how the brain repairs itself. So, and that's always a hard thing. As we get older, sleep is a lot harder. Hydration, staying hydrated, right? Because remember, blood is mostly made out of water. And then caffeine. Be careful on your caffeine intake because that will dehydrate you. The other thing it does is it can contribute to heart palpitations. So people can get heart palpitations from it, and that can make you dizzy, right? And again, we talked about that there are some triggers, some food triggers that will flare up a person that has migraine or even Meniere's disease, or something called a Meniere's diet, where you're really avoiding things like lunch meat, because there's a lot of additives in lunch meat. Salt, heavy salt intake. Be careful of like prepared soups. Canned soup, everybody, my brother, right? My brother recently had surgery and I went down to help him. And he thought he was doing a really great job. He bought all kinds of soup, commercial soup. And I was like, this is probably the worst thing you can eat. Because there's so much sodium in that prepared canned soup. So be careful, salad dressings, prepared salad dressings even have a lot of salt and MSG in them sometimes. So there's some additives and things in our food that actually can trigger people into having a Meniere's attack or even a migraine attack. Chocolate, cheese, lunch meats, those kinds of things. Additives, food preservatives, MSG, too much salt, too much sugar, all that. Again, movement helps. Motion is lotion. All All right. I'm sorry that I gave you that much info. I'm not sorry. I love talking about this stuff, so I take it back. I'm not sorry at all. But does anybody have any questions that we did not address? Yes.
Is there a cure for tinnitus?
Oh yeah, so tinnitus, there is no cure for it. Tinnitus sometimes happens because we lose different frequencies for sound, like different ability to detect sound frequencies. So what happens in its place is that ringing. But there is treatment for it. There are some audiologists that do something called tinnitus retraining therapy, and there's a person at the Eye and Ear Institute, her name is Laura, I think it's Lori Zatelli, and she's an audiologist, and they will do tinnitus retraining. And so basically, what you're doing is you're teaching your brain to ignore that tinnitus sensation that you're getting. And they might use devices for that and take them away. So that's, so you can, especially with tinnitus, you know, when you first get it, you might get used to it and then basically it goes away. But people that have problems with tinnitus have a lot of trouble doing that. Like their brains can't do that. They're really focused on it. So, yeah, there is, so tinnitus is kind of a separate issue, really. You can have tinnitus and no balance issues at all. Yeah. You can have hearing problems and no balance problems. So they're not necessarily one. They don't necessarily go hand in hand. Any other questions?
You have the vertigo without the positional vertigo?
Yes. You can have vertigo without the positional problem. Right, and that's typically, again.
What is that? What are those?
So it might be a virus attacking the nerve. So that person, if you have a virus that attacks your nerve and you get vertigo, you may not have any. It might not work. It may not matter what you're doing per se, and then that typically gets better. But then you might have issues with your balance or dizziness with certain movements. But that's sudden. If you have a sudden loss of function of one ear, you will get vertigo. You'll feel like you're spinning. And again, there's more than just what I put up. Believe it or not, there's more than what I just put up there. But those were the most common types of vertigo. Most common causes of vertigo. Yeah.
Another thing, what's the correlation between the diabetes and the vestibular problems? Is it your estimation?
Yeah. I don't know if I really have seen any studies on that, but I personally have seen a lot of folks who have a balance problem because you can't, just like you can have you probably already know you can have vision problems, right, from diabetes. What happens is it's called a retinopathy. You know, your eyes are not functioning as well. Well, it's the same thing for the inner ear. You know, we have a blood supply that supplies our inner ear. So what happens is you might lose function. So in other words, you know, your inner ear is not sending the signals like it's supposed to. And so that makes your balance off, or it might make you dizzy, or it might make, especially when you're doing a particular, like if you're walking on an uneven surface and there's a lot of activity moving around you, so you've got a lot of visual motion around you, and you've got, you know, uncertainty in the ground and the surroundings. So people will often get off balance or dizzy even just from that, you know, and that, it happens more with just, not just with people with diabetes, it can happen with folks who don't. But diabetes, it depends. If you're really struggling with controlling your diabetes, then this might be more of an issue. So, yeah, it's a good question. Any other? Yeah.
You said that it's not just part of aging. So if the doctor is saying to you, you're just getting older,
I mean,
you press that.
Technically, you could, like I did explain, that we do get, you know, we do have aging changes to our vestibular system. But I guess the thing I want to point out is that doesn't mean that you don't do anything about it. It means that you might need to see a PT that specializes with vestibular balance disorders. And I would do that, you know, because there are people walking around, I forget what the percentage is, it might have been 8 or 9% of people are walking around with BPPV, with their crystals being out of place, but they don't know it, because you don't always get dizzy with it. And the truth is, people as they get older, are less likely to have the vertigo symptoms than someone who's younger. So I've seen a lot of folks with their crystals are out of place, they're having a balance problem, maybe they've fallen a couple of times and nobody can figure out why. And here, their crystals are out of place, but they don't have the typical vertigo symptoms that other people do. And I see that more with older folks, with people that are older than people who are younger. And I think a lot of that's because of the aging changes with the vestibular system. Your ears are not sending the signals as strongly as they used to when you were younger. So you might not really get that dizzy from it. So they're actually suggesting now, there's some research and studies, they're looking at any older person that's having a problem with balance and falls should maybe get that checked. Especially if you haven't figured out other reasons for it. Yeah.
Do most ear, nose, and throat specialists now send people to PT for the Epley maneuver and things like that, or is it still not? It seems to me like when I first went, the doctor didn't really send me to the right spot, and it wasn't until my daughter learned about it in school that she was able to fix it on me.
Yeah.
So I was wondering why some of the doctors aren't aware.
It depends on the doctor. I will tell you, because I've been doing this a long time. When I first worked at the Eye and Ear Institute, this would have been in the early 90s, and most of those folks, by the time they came to us, had seen probably 8 or 9 doctors. And now it's not like that. So I would say now, like, there are some people that just come to the PT. Like, the minute they get it, they go to PT. They go to the vestibular PT. Not all PTs are trained in this either.
Right.
So you want to be careful of that. Like, they all learn it in school, but they may have made limited, times treating this. And so if you've got something that's really chronic or complicated, like they may are able to treat the simple ones, but the more complicated ones are going to be a lot harder for those folks. So, like I said, in the Pittsburgh area, we're lucky because I could name about 10 people to send people to that are experts, which is pretty awesome and unheard of in a lot of other places.
Mm-hmm.
Yeah, but it's definitely better than it used to be, and it'll probably continue to be better. But there are a lot of, most ENTs nowadays, like they might have a person that they technically refer you to. But I've had some folks where they came to see me and they were like, yeah, my ENT has an audiologist that does it in their office, but I didn't get any better from it. So, like I said, if you're not having luck, there's always other people to go to.
Okay.
Yeah, but I will say that I've seen multiple people. Audiologists also are trained in this, but I just think PTs have a better, like audiologists are great with hearing loss,
Right.
but PTs have a better understanding of balance and movement that audiologists don't have. So they might be able to do, an Epley maneuver on somebody, but if it's not in the posterior canal and it's in a different canal, you're not going to do an Epley maneuver. So you have to really be able to distinguish where this is.
Okay, thank you.
Yeah. Any other questions? These are great questions, by the way.
If your balance issue is related to spinocerebellar ataxia, is
Yeah.
that somebody different than the ear? Like, would that be a different type of PT?
Pretty much, yeah. So a spinocerebellar ataxia, that is really more of a motor problem. So remember we talked about sensory and motor. So someone that is maybe having like cerebellar degeneration, those spinal tracts are degenerating as well. But again, you would want to see a PT that's really comfortable with neurological problems. And so for me, I'm board certified in neurological PT. So most neurological PTs, a lot of them in this area are also comfortable with vestibular issues as well. Not all of them, but for the most part, you want to see a PT that's really more neuro-focused. In other words, you don't want to go to the PT that fixes your back when your back is out. That person's great. And they may be more of a generalist, and they may be able to handle, but you really do want to see more of a neuro specialist. But, You know, again, it depends. Like if you live rurally, you may not have any options, right? Like there's people that live in the middle of the state that don't have, you know, they might have a PT that they go to, and that person has to be trained in like so many different things. And that's okay too, if that's what, you know, what you need to do.